Hi, I'm Dr. Murray Reicher. I'm chairman of DR Systems and co-founder of Health Companion, a personal health record, and I'm here today to speak with you about meaningful use for specialists such as radiologists, anesthesiologists, and pathologists. DR Systems is a privately held company based in San Diego. We provide a complete unified solution for medical imaging informatics, and that includes our radiology information systems, our F.A.C.R systems, cardiovascular information systems, solutions for women's health care that includes viewing of breast imaging and MQSA tracking. We also have cloud-based solutions that include our electronic health record that provides meaningful use compliance for medical imaging, which we'll be speaking about today. Emix, which is a cloud-based solution for image and data sharing. Our zero download viewing solutions where a patient or doctor can view medical images on a phone or mobile computing device without having to download a locally resident software application. And we're now moving into the pathology arena with a solution for anatomic pathology informatics and reporting. We also provide a complete integrated solution for advanced visualization, including multiplanar reconstruction and 3D volume viewing. DR Systems believes that medical imaging informatics is going to simplify over this next generation. Today, most hospitals and imaging facilities own as many as 10, 20, or 30 different information systems in order to provide all of the informatics solutions that they require for things like PACS, RIS, advanced visualization, CAD, MQSA tracking, and other related solutions. With DR Systems, you can simplify that into a single Unity solution that provides you what we call enterprise imaging excellence, an opportunity to reduce costs, improve training of all of your healthcare professionals, and radically reduce the number of required interfaces. Emix again provides our electronic information exchange so that hospitals, imaging facilities, laboratories, and other healthcare constituents can exchange information confidentially and securely. And we also believe that we're now entering an era of patient engagement. As we grow from 10 million to as many as 70 million Americans in high deductible plans, we believe that consumers will need tools to exert and understand the choices that they have in selecting healthcare providers, and that meaningful use provides us a tremendous opportunity as providers to engage consumers, and that our specialists, such as radiologists, pathologists, and anesthesiologists, would be ill-advised to miss this tremendous opportunity to receive federal funding to implement the technologies that will be the must-have technologies of the very near future. So if you're listening to this presentation, you're probably interested in understanding what meaningful use is, who's doing it, what's in it for you. If you're a doctor, if you're a hospital or imaging center, what's in it for you? What's required? Are interfaces necessary? How do the patients fit in? Is this strategic for my organization? And can I use the money to fund other IT initiatives? Meaningful use came about as a result of the American Recovery and Reinvestment Act. It's a program that stimulates hospitals and eligible professionals to implement technology that adheres to certain standards and to use those technologies in very specific ways. Initially, eligible professionals were able to receive a bonus of up to $44,000. Now, as of 2013, that's $39,000 for those enrolled in the Medicare EHR incentive program, and higher bonuses are still available for those in the Medicaid program. You can enroll in one or the other as a physician, not both. This is a schedule of the available rewards. You can see for eligible professionals that begin in 2013. The first payment is $15,000. totaling up to $39,000. On October 3rd of 2013, the maximum available bonus will significantly drop to $24,000. So all those interested have a significant incentive to begin participation in the program before the fourth quarter of this year. Beginning in 2015, Medicare penalties kick in, and although there are some exemptions to these penalties, there are no long-term exemptions to these penalties on the books at this time. To be an eligible physician, you must bill Medicare $24,000 a year. If you do less work than that for Medicare, you may still be eligible for a proportionately lower incentive payment. And 10% of your services must be performed in an outpatient setting as defined by one of the 5 place of service codes you see before you. This is a physician or a eligible professional centric program. For radiologists, anesthesiologists, and pathologists that often work in multiple facilities, it's critical for you to realize that this program is attached to the professional, not to the facility. The technology must be available where you see at least 50% of your ambulatory encounters, and this really calls for a cloud-based solution that can be available wherever the eligible professional goes. There are very few timeliness requirements that come into play here. There are a few, however, such as the transfer of timely information to the patient, which in stage 1 must be done within 3 to 4 business days, depending on the precise requirement, dropping down to 1 business day in stage 2. Eligible professionals can define a visit so that a visit can be restricted to just those events where there is a face-to-face encounter between the eligible professional and the patient. And this certainly lowers the hurdle for professionals such as radiologists and pathologists to get involved in the program, because you may successfully participate while following the workflows that are required by meaningful use for the small minority of patients where you have face-to-face encounters. There is no requirement to provide the patient the radiology report, but it's an exceptionally common request by patients, and it's a solution that we can provide through our systems. And for radiologists and pathologists in particular who normally don't record vital signs, there are exemptions for that. So if you look at the meaningful use requirements as a professional and you've been discouraged by what seems to be a daunting list of requirements that don't apply to your practice, recognize that there are reasonable exemptions that make it relatively easy for specialists such as you to comply with the program. Similarly, the clinical quality measures, which for many radiologists, anesthesiologists, and pathologists don't really seem appropriate to the scope of your practice, will generally be reported as zeros if you don't have the type of primary care office visits that trigger the CQM requirements. Again, for most professionals today, most imaging centers, hospitals, surgery centers, people on the technical side, there's a tendency to view this entire program as an opportunity for a bonus or a way to avoid a penalty, but there's really much more to it than that. This is an opportunity for you to gain clinical relevance, to increase your visibility to the patient, and to provide direct communication to the patient that really creates the relationship between you and the patient that you may have been lacking previously. And that increases the likelihood of patient loyalty and patient appreciation for the service that you provide. In addition, it creates an opportunity for you to provide information to all of your patients as an aggregate through simple web messaging as these patients accumulate over time. A little bit of background, why is the federal government so interested in meaningful use? We recognize as a nation that there is a need for wellness and there's a need for evidence-based medicine. We understand that if systems can actually communicate with each other and eligible professionals can, we can have less redundant testing, less medical errors, better, prompter patient access to medical records. And in addition to that, for physicians in the radiology, anesthesia, and pathology space, there is really an urgent need to connect to the patient or risk commoditization. The core problem in the U.S. today, perhaps the greatest social problem of our time, is that we have very poor health in general. We have high obesity rates and still relatively high smoking rates, hypertension, lack of immunization. This leads to very high costs, which has turned the Medicare budget upside down, which has led to, in part, to the federal budget crisis. As examples, we have nearly 40 million undertreated hypertensives in the U.S., very high obesity rates, smoking of in about 20% of adults throughout the country, with only 2 states currently showing any decline. Injuries continue to be a problem despite technologies that can avoid them. And we do a very poor job with screening and immunizations. For example, in 2012-2013, our hospitals were filled due to the flu epidemic, yet very poor compliance with the flu shot, which is one of the most cost-effective public health measures known to man. So if you get nothing out of this presentation but the following slide, we know we've benefited you. Turns out if you don't smoke, if you eat a balanced diet low in red meat, if your body mass index is under 30, and if you exercise 150 minutes a week or roughly 30 minutes a day, you have a far greater chance of avoiding unnecessary disease and unnecessary cost. In fact, according to one study done by the CDC, relative risk, if you do those 4 things, of the diseases you see on this slide reduce dramatically. What would this do to our healthcare expenses and the overall well-being of our nation if we could get people to simply behave in a better manner? Meaningful use provides an opportunity for you to communicate with your patient in a way that not only engages them, but stimulates them towards greater wellness compliance. Now, if you're thinking that you can avoid meaningful use, I've got news for you. Your colleagues are doing it. As of the end of 2012, there were nearly 356,000 eligible professionals in the program. They comprise many specialties. Nationally collected data shows that 72% of office-based physicians are using EMRs, in some states as high as 89%. 2/3 of office-based physicians report participation in the EHR incentive program. EHR Intelligence did a survey published on November 8, 2012. Of their respondents, 7 out of 8 said that they were participating in the EHR incentive program, and nearly all of those not participating said they would. Another survey showing very high adoption of meaningful use among primary care ambulatory physicians. So we've really passed the tipping point. Not participating in meaningful use in 2013 is a little like saying, I'm not going to do email in 1994 or 1995 when everybody else was starting to hop on the email wagon. It's not really avoidable because everybody else is doing it. Now, in the fall of 2012, CMS said, you know what, we'll make it a little easier for radiologists, anesthesiologists, and pathologists to claim exemption and avoid penalties. However, in order to avoid these penalties, you have to annually apply for an exemption, and you have to realize what you're achieving when you hardship out of the program. You're achieving an ability to avoid a bonus. I don't believe you're achieving the ability to avoid the technology, because you're going to have to implement the type of technology that allows you to communicate with your referring doctors and your patients. Patients are going to expect to receive clinical summaries that they receive from all of their other doctors, from their radiologists, anesthesiologists, and perhaps even their pathologists. And failing to participate now simply avoids an opportunity to have the federal government help fund a program and fund technology that will be the must-have technology of the next few years. So why is hardship a bad idea? First and foremost, everyone else is doing it. Meaningful use compliance will soon become a competitive necessity. It'll be your primary service tool for engaging your patients and communicating with other doctors in your community. It's the best way to obtain clinical data from referrers if you're a radiologist, pathologist, or anesthesiologist who needs this information in order to appropriately manage your patients. And it's the best way to improve your clinical relevance and engage your patients. This is an example of medical imaging informatics in, say, the 1990s or the first decade of the 21st century. Information technology following the patient care workflow from the point of the patient appearing at the front desk all the way through management reporting. Meaningful use goes outside of the enterprise and says, now it's time to not only use technology within an enterprise, but to use a common set of standards to communicate throughout a community between hospitals, imaging centers, laboratories, payers, doctors' offices, and most of all, the patient, in order to communicate with the patient who really belongs at the center of this hub. With DR Systems Solution, your hospital information system, or EMR, communicates with our cloud-based EHR in order to populate any data that you may have from upstream systems. But if for some reason you don't have IT support, and this interface between the HIS and the EHR is not feasible in the required time frame, you can still directly enter data into the EHR, invest the 0 to 5 to 10 minutes a day necessary to do this if you're in the specialties that I'm addressing here, and comply with the program while learning about it and engaging your patient. The information from the EHR after the visit goes to the patient's health companion personal health record, where they can view it, receive it, store it, share it with appropriate family members and friends, learn about prevention and wellness, where you as a provider are entered into the patient's phone book of providers in their personal health records, so they have a connection with you, and where the patient can collect data from other providers and serve as their own health information exchange. The cloud-based solution is favored for a number of logical reasons, mostly because radiologists, anesthesiologists, and pathologists frequently work in multiple locations, and they need a solution that is mobile, that is available anywhere they work. A few words about the difference between our PHR and a portal. Just about any system you look at today will provide a portal. It's a requirement of meaningful use. A portal is simply a way for a patient to access a record from one provider or one organization. Patients prefer a PHR. Why? Think of yourself as a patient. Do you see multiple physicians and multiple providers in your family? Do you think of your kids and the senior generation in your family? How many different providers and organizations do they go to for healthcare? Do you want a username and password for each one of these separate individuals and separate providers? Or for your family, do you want a single record that you control, where you can access all of the medical information that you need from all of your providers? That's the benefit of a PHR. It's a lifetime record. It ties not only to your providers, but to employers and payers, and gives you an opportunity to also connect in your family and friends in a manner where you can share information with those that you wish to, and not share information with those that you don't wish to. This is what it looks like if you're using an electronic information system. This happens to be the DR Unity system you're seeing right now, but it could be any electronic information system. The Meaningful Use system is available as a web service. There's a ribbon that shows all users the level of compliance that has been achieved per patient visit. This is an example of what a radiologist or a pathologist might see if they're looking at an image management system. Click a button and images are available, and synchronized with the image display and the user is the Meaningful Use data, again available as a web service. This is a close-up that shows you that we not only have this ribbon that allows you to easily understand your level of compliance, but we've aggregated the key data entry into a single page. This is what the patient's personal health record looks like that allows you to message the patient. Do you have a tool today where you can reach all of your patients by typing a single note? Does October have to be Breast Cancer Awareness Month in your practice, or can every month be Breast Cancer Awareness Month? With the Meaningful Use solution we provide, tied to the Health Companion F.A.C.R, you gain a method of communicating with all of your patients anytime you want to in a very simple manner, and you also gain the ability to understand your patient's aggregate performance with regard to prevention and wellness. Our system, in order to stimulate compliance, provides real-time tracking of each eligible professional and their adherence to the core set of 15 objectives that are required by CMS. If you're a physician in the groups I've mentioned and you take the exemptions that most physicians normally do in these specialties, all of the yellow rows are in compliance by basically turning the system on. By using the F.A.C.R, you gain compliance to a couple of more of the core objectives. And so the data entry required is very minimal. Problem list, meds, med allergies, demographics, and smoking status. If we can collect that information from an upstream system, great. If we can't, the time invested in collecting this data from the patient and manually inputting it ranges between 1 and 2 minutes an exam. If you're restricting your data entry to the patients with whom you're having face-to-face encounters, for a radiologist or pathologist, that means little or no data entry. Maybe 5 minutes a day of data entry. It can be done by you or an employee under your supervision, and you're in compliance, and you're beginning to engage your patients while earning a federal bonus. Under Stage 1 Meaningful Use, there's also a menu set of 10 elective clinical objectives. You must do 5 out of the 10. You get credit in 2013 for the exemptions that you claim. So our experience with our users has been basically turn the system on and you're in compliance. But the use of the F.A.C.R brings our users into compliance generally with 9 out of 10 of the menu set items, and the last one is easy to do as well, the med reconciliation. How do you get started? It can be as simple as completing a paper form or having the patient complete a paper form in your waiting room that allows you to collect the Meaningful Use data, and then inputting that data into the cloud-based solution that we provide, tracking your compliance, which we'll help you with, and then attesting with CMS. Again, there's more at stake here than the bonus. Sure, there's a bonus, and definitely that's a stimulant. But this is also an opportunity for you to engage your patients. If you'd like to send them medical imaging or other reports, if you're an anesthesiologist, perhaps to collect post-op information or to send them specific thanks or notes about their surgery and what to watch out for. And you can do all of this electronically after the visit without any paperwork. So what do you do? If you're interested, first of all, understand what's at stake. Don't opt out because you're only opting out of a bonus. You're not going to opt out of the need to adopt meaningful use compliant technology. Consider how strategic patient engagement is for your practice. Recognize the physician-centric nature of this program and the need for a cloud-based solution. Create a plan that can rapidly evolve as the rules and competition changes, which also, if you think about it, this criteria also favors a cloud-based solution. Recognize the unique workflows in imaging and pathology and in anesthesiology as you implement this technology, and do it. You have till October 3rd, 2013 to still be eligible for up to a $39,000 incentive payment. There's no reason to lose this incentive. For your action plan, if you're a physician, this is simple. Call us. We can set you up. You could be using our technology within the next 48 hours and on your way to compliance. If you're a hospital or an imaging facility or a surgery center, talk to your eligible professionals. If those doctors were planning on opting out and not receiving the bonus, you have an opportunity to take care of this problem for the physicians, remove the axe hanging over their head with regard to penalties, improve the clinical information they have when they take care of patients, and negotiate an appropriate sharing of the bonus money. Perhaps a physician would tell you, if you'll take care of this for me, I'll assign the bonus to you. Just get me into compliance. Few comments about some changes that are occurring in 2013 and 2014. There are some relatively minor changes in both the core set and menu set items. You can read about them here. Contact us and we'll explain them. I think the core message for us to you is that we're on top of the changes that are occurring, and because we have a cloud-based solution, those changes will be deployed to all of our users simultaneously. There are a variety of changes in the core set and menu set items, and here's a quick summary of the core set item changes, quick summary of the menu set item changes. Some other key factors to understand: if you entered the EHR incentive program in 2012, your deadline for entering stage 2 has been pushed back to October 1, actually, of 2014. Instead of 15 core items and 5 menu set items, there's now 17 core items and 3 menu set items when you enter stage 2. The exclusions no longer count in your favor, still easy to comply. There are some key changes in stage 2. That really favor the use of the type of technology that we provide. One change is that you'll need to know that at least 5% of your patients view, download, or transmit information they receive from you to a third party. And this is why the Health Companion Personal Health Record is so important to our solution. You'll need to transfer at least 10% of your continuity of care documents to other providers when there is a transition of care. And a transition of care means a referral from a referring physician to an imaging center or a hospital for an ambulatory radiology visit, for example. Electronic transmission of information between providers steps up in stage 2. You'll need to know that at least 5% of your unique patients received secure messaging from you. And this is another reason why our combination of an EHR and PHR is so important in moving forward to stage 2. So please use the opportunity you have today to enroll in the EHR incentive program. Work with DR Systems and we can help you achieve compliance in a simple and straightforward, cost-effective manner that serves both the legal requirements and the spirit of the EHR incentive program. Call us today, contact us by email, and we'll help you comply in a way that increases your visibility to patients and increases your patient satisfaction, as well as the satisfaction of other physicians who want to use the meaningful use standards to communicate with you in their everyday practice. Thank you very much.